Hey, 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 welcome back to Following Science, the podcast where we delve into the latest scientific discoveries and unravel the mysteries of the world around us. I'm Ritu Raparo, your host today, and in today's episode, we're going to be taking a comprehensive look at breast cancer. We're going to cover everything from the basics to risk factors to diagnosis to treatment options and the latest research advancements. So, whether you're looking for detailed information or just a general overview, this episode is for you. So, let's dive right in. Let's start with what breast cancer is. Breast cancer is a type of cancer that forms in the cells of breasts. It's the most common cancer diagnosed in women worldwide. Although men can also develop it, it's not as common in them as it is for women. Now, breast cancer begins when cells in the breast start to grow uncontrollably. These cells usually form a tumor that can be often seen on an X-ray or just felt as a lump on your daily life. This tumor is malignant if the cells invade surrounding tissues or spread to other parts of the body. There are different types of breast cancer, and the most common ones are ductal carcinoma in situ, or DCIS, which is a non-invasive cancer where cells are confined to the ducts in the breast and haven't invaded surrounding tissue. And then there's invasive ductal carcinoma, which is IDC. The most common type of breast cancer is IDC, where cancer cells break down on the ducts and invade nearby tissues. And then there's invasive lobular carcinoma, which is ILC, and it begins in the lobules and can spread to nearby tissues. Now, let's talk about some risk factors and prevention. Understanding the risk factors for breast cancer can help its prevention and help in early detection. And some risk factors are beyond our control, others can also be managed through our lifestyle choices. Because you'd be surprised at how many different lifestyle choices can affect different rates of risk in different types of cancer, specifically breast cancer for females. Now, some uncontrollable risk factors are gender. Women are at higher risk than men, so they can't really control that. And then there's age, the risk increases with age. Again, can't really control that. And then there's family history and genetics. A family history of breast cancer or inherited genetic mutations like BRCA1 or BRCA2 significantly increases the risk. And again, you can't really do anything about that because it's in your genes. But there are also some controllable risk factors which you can control and improve your lifestyle choices to ensure that you're reducing your risk of breast cancer as much as you can. First one is alcohol consumption. Limiting alcohol intake can reduce the risk. Then there's weight. Maintaining a healthy weight, especially after menopause, can ensure that you're controlling your risk of breast cancer. Then there's physical activity. Regular exercise can lower the risk. And then there's hormone replacement therapy. Using hormone therapy for more than 5 years increases the risk of getting breast cancer. So if you can avoid it, you should definitely avoid having hormone replacement therapy because it does increase your risk of breast cancer. Now, some preventive measures can include things like having regular screenings, self-examinations, and in some high-risk cases, preventive medications or surgeries. Now, let's talk about some symptoms and diagnosis of breast cancer. Recognizing the symptoms of breast cancer early on can lead to more effective treatment. Common symptoms include things like a lump or thickening in the breast or underarm, change in size, shape, or appearance of the breast, changes to the skin over the breast, such as more dimpling, something you might have not noticed as much before. Something such as a newly inverted nipple could also be a risk of breast cancer or just a common symptom. Then there is redness or pitting of the skin over your breast, like the skin of an orange. Now, if you notice any of these symptoms, it's important to see a doctor immediately. Oftentimes, diagnosing this breast cancer involves several steps, which the doctor takes, and sometimes you can also take on your own, such as self-examination. So, oftentimes, diagnosing breast cancer starts with self-examination and clinical breast exams. Now, regular self-exams and clinical exams are often given by a healthcare provider, and it's super necessary and kind of serves as a preventive measure because if you're getting examined all the time, then you can catch it if it's too early, or you can just make sure everything is according to normal. And then there's mammograms, which are just X-ray images of the breast, and it's used to detect early signs of cancer. So what you might not be able to see on the outside, such as like dimpling, you might be able to see through X-ray images, which is why it's so important. And then there's ultrasound. Uses sound waves to produce images of structures deep within the body, and it can detect early signs of cancer. And then there's biopsy. It just involves removing a sample of breast cells for testing. And also, you can use advanced imaging techniques like MRI for diagnosis and staging of breast cancer, but people often don't use it to start off. They start with the self exams, x rays to make sure what they're seeing is normal. And if they end up finding something that looks abnormal, but they can't really tell what it is, that's when they go to the advanced imaging techniques. Now, the treatment of breast cancer depends on the type and stage of the cancer, as well as the patient's overall health and preferences, which is why it's so necessary to make sure that you're having good lifestyle habits early on, regardless of whether you've been diagnosed or not, because it can affect your treatment and just affect the type of cancer you get. So, some common treatment options include things like surgery, and options range from lumpectomy, which removes the tumor and a small margin of the surrounding tissue, to mastectomy, which removes one or both breasts entirely to ensure that the cancer is not spreading to any other part of the body. And then there's radiation therapy, and it uses high energy waves to target and kill cancer cells. And then there's chemotherapy, and it involves using drugs to destroy cancer cells and are often used before surgery or after. And then there's hormone therapy. It blocks hormones like estrogen that can promote cancer growth. And oftentimes, if you've been diagnosed with breast cancer, you're given pills to make sure that your hormones remain blocked for a long period of time to prevent estrogen from being made so that it promotes breast cancer from coming back even after you've recovered. And then there's targeted therapy, and it uses drugs or other substances to precisely identify and attack cancer cells, often with fewer side effects than chemotherapy. Now, let's talk about some of the latest research and advancements. And this is going to be a pretty big segment because there's a lot happening in the world of cancer right now, specifically breast cancer. Because breast cancer research is constantly evolving, and it brings hope for better treatments and outcomes. Now, let's go into some of the latest advancements. I'm going to be going over immunotherapy, precision medicine, PARP inhibitors, liquid biopsies. So let's start with immunotherapy. Immunotherapy is a revolutionary approach to cancer treatment that harnesses the body's own immune system to fight cancer cells. Recent advancements in immunotherapy for breast cancer include things such as checkpoint inhibitors. So, in checkpoint inhibitors, these drugs help the immune system recognize and attack cancer cells. Now, a lot of these inhibitors have shown a lot of promise in treating triple negative breast cancer, a particularly aggressive form of the disease. Now, there's also cancer vaccines. Researchers are developing vaccines designed to stimulate the immune system to target breast cancer cells. These vaccines are still largely in the experimental stages, but early results are very encouraging. And then there's adoptive cell transfer. This technique involves modifying a patient's own immune cells to enhance their cancer fighting abilities. EART cell therapy, which has shown success in blood cancers, is adapted for breast cancer treatment. And then there's precision medicine. Precision medicine tailors treatment based on the individual genetic makeup of the patient's cancer. Now, some key advancements in precision medicine specifically include things such as genomic testing. They use different tests to analyze the expression of specific genes in breast cancer tissue to predict the risk of recurrence and guide treatment decisions. And based on this, they decide what to do with the cancer and if they think it's going to come back and stuff like that. And then there's also BRCA1 and BRCA2 testing. Now, genetic testing for BRCA mutations help identify individuals at high risk for breast and ovarian cancers. PARP inhibitors, such as linperaz, have been developed to specifically target cancers with these genetic mutations, and they're showing a lot of promise in helping with treatment. And then moving on, there is liquid biopsies. These tests detect cancer-related genetic material in blood samples and offer a less invasive way to monitor cancer progression and response to treatment. So a lot of the other treatments I've mentioned before can be very invasive to the body and it can cause a lot of negative effects. And liquid biopsies is a great way to avoid that because it's less invasive and it just measures it in your blood samples. So it's also very precise in many ways too. and it can provide real-time insights into how cancer is evolving and whether the other treatments that are being provided to you are actually effective or not. And then there's PARP inhibitors. PARP inhibitors are a new class of drugs that target cancer cells to repair DNA damage, particularly in patients with BRCA mutations. These drugs have shown significant efficacy in treating advanced breast cancer and are being investigated in earlier stages of the disease. Now, let's go into talking about target therapy. Targeted therapy focuses on specific molecules involved in the growth and threat of cancer cells. Recent advancements include things such as HER2 targeted therapies, which talks about overexpressing the HER2 protein, and it can be treated with other targeted drugs, which promote and show a remarkable efficacy in patients who have progressed on other HER2 targeted treatments. Now, let's talk about early detection. Early detection can really happen through liquid biopsies, and it can happen through self-examination. So if you're just in the mirror and you're just standing there and you feel like a lump, or you just feel something abnormal and it looks kind of weird, it's always a good idea to go and check it out because you never know what could actually be happening. So let's talk about monitoring treatment responses. All these tests can track how well a treatment is working in real time, and it can allow for a more personalized and adaptive treatment plan, which is very necessary because, again, everyone's body is different, and it's necessary to have treatment plans that is personalized specifically for you because that's the only way that you're going to be able to use it in a way that's beneficial to you. Now let's go into talking about living with breast cancer. Now, being diagnosed with breast cancer is life-changing, but support is available. Emotional and psychological support, healthy lifestyle choices, and a strong support network can make a significant difference in your life when you are diagnosed with breast cancer, or even when you're just living with somebody who has been diagnosed with it. And there are many resources available for both cases, including things such as support groups, counseling services, and patient advocacy organizations. And it's always important to get involved in things like this because you never know how much you going out and talking to somebody can help you, or you just leading an advocacy group and talking in support groups can help the other person as well. Now, as we wrap up today's comprehensive overview of breast cancer, I just want to talk about what we've covered, which is things such as risk factors, symptoms, diagnosis, treatment options, and some latest research that's been happening. Now remember, early detection and treatment is crucial in any type of cancer, specifically breast cancer. So regular screenings and awareness of the symptoms can save lives, which is exactly what you've just done by listening to this podcast. You've figured out the symptoms, you've figured out early detection. And so in any case, hopefully you might not need it, but in any case, if you do end up needing it, you know exactly what to do and how to go about it. So, as we wrap up today's episode, I just want to thank you all for listening to Following Signs. If you have any questions or topics you'd like me to cover in the future episodes, please reach out. Now, stay informed, stay healthy, and until next time, keep following signs.